Happening right now, hospitals in a lot of stress this morning as a band of respiratory viruses collide right before the holidays. Cases of the flu and RSV have already begun to spike nationwide, and there is still, of course, that spread of COVID-19. Dr. Peter Kambelos is joining me now in studio to talk about all of this, bring us through, especially with the fact that Thanksgiving is 4 days away. So, Doctor, thank you so much for joining us. Really appreciate it. I mean, first up, tell us a little bit about the situation that's happening at hospitals here in the Southwest Ohio and greater tri-state region.
I'm glad to be with you, first of all.
Yeah.
And we are seeing an increase in the incidence of the flu currently. And interestingly enough, in Southwest Ohio, our numbers are second only to the Dayton area in terms of hospitalizations related to the flu. And in terms of case counts, the local county, Brown County, is actually second in the state in terms of its case numbers at this point in time.
So Thanksgiving is 4 days away, as I mentioned. What are your recommendations to stay safe during the holiday, and especially as we head even into Christmas, New Year's?
Well, first and foremost, the top three prevention strategies for influenza are vaccination, and you guessed it, vaccination.
Wow.
It's a little bit too late for Thanksgiving. Usually it takes about 2 weeks to build antibodies against influenza after vaccination. However, some other simple things that I think about which the public should be aware that can actually reduce spread. Number one would be correct and frequent hand washing. Correct meaning, washing the hands to the tune of happy birthday.
Yes.
So adequate.
Little trick there.
You got it. And it does work,
Yeah.
And reminding children, teaching them, that's a kind of a fun way to do that. So correct hand washing. Number two, if you're sick, this is very simple math. If you're sick, stay away. Spread joy, not germs. Not a complex concept, but a lot of people forget, and they do show up to family functions and things of that nature when they're sick. If you're sick and in a situation where you have to cough or sneeze, it's always a good idea to cough or sneeze, not into your hand, but into your elbow or into a Kleenex. And then, of course, regularly cleaning contact surfaces that can increase spread, such as countertops, doorknobs, bathroom sinks, and the like. Always a good idea to keep those areas sanitized.
I remember getting the flu twice in like a 3-year span. This is kind of in high school, college. And I remember, it takes such a toll on your body. What are those first symptoms that you should be looking out for if you do get the flu, if you do get maybe RSV or have a child with symptoms?
Some of the most common signs and symptoms are high fever, aches, body pain, general malaise, sore throat, headache, cough, runny nose. Those are pretty common symptoms related to the flu, but can also overlap with other syndromes, as you suggested, such as RSV and perhaps even COVID. Of course, COVID has some frequently identified signs and symptoms that are relatively unique, such as loss of taste or smell.
Totally.
But those are the most common signs and symptoms of influenza.
We've been hearing, and as you've been mentioning, those hospital numbers are starting to get a little concerning in specific areas, some places in our area as well. When do you know it's a sign that you should go to the doctor, you should go to the hospital? When, do you have symptoms that you could say, hey, I can ride this out at home, isolated? What would you say to that?
Well, if you have any questions or concerns, it's obviously a great idea anytime to contact your doctor for advice.
Okay.
That's going to be your best source of information rather than the internet or Google or what have you. In terms of distress, if you're having trouble breathing, shortness of breath, severe chills, high fever, confusion, mental status changes, not eating or drinking, those are important signs and symptoms to recognize and get to the hospital.
All right, Dr. Kambelos, thank you so much for coming on. Really appreciate it.
Thank you.